Hi, everybody. Welcome to FinTech Fun Talk. Today we have a great guest. Her name is Michelle Dowling, and she works for Rectangle Health. That is a healthcare technology platform. And we'll be talking about her experience in the FinTech world associated with healthcare technology. Welcome, Michelle.
Thank you so much for having me, Christy.
Of course, happy to have you here. So let's start with, from your perspective, what has changed in the FinTech world in recent years, and specifically in healthcare?
Sure, this is a huge question, but I can say that over the last couple of decades, we've seen tremendous change from a digital perspective. One from the simply just going from cash and check to credit card. And then we moved into EMV when we all got those little chip cards and we had to change out our cards. That was a big challenge for healthcare to convert over to their systems where we could accept chips. But the next layer onto that was how can we provide online options? And then the biggest shift of all, of course, as everyone well knows, was COVID. And when, for the first time in history, the dental and medical organizations shut down, they had no choice but to pivot to digital tools. If you can remember,
Right.
before then, your doctor or dentist was not sending you text messages or emails.
Mm-hmm.
But when we had to wait in our cars and the text come in, or our primary method of communication changed from phone calls to emails, this was leveled up healthcare in a tremendous way and opened the door for us to also collect digital payments for the first
Mm-hmm.
time in a more significant manner. After that, it became the norm to get an online scheduling link or a reminder that your appointment was coming due. We have tried to add on things like, oh, Christy, by the way, you have an outstanding balance of $50. Click here to pay it now so that we can continue adoption of digital methods and honestly best practices of payments into the healthcare organizations and the healthcare industries. Been successful, but there's so much more to go.
Mm-hmm. Yeah, there is. And it's interesting because with that thought that there's always something more to do and always progress to be made,
Correct.
I do look at that time frame with the pandemic and watching it both as someone who is a professional in the industry and as an end user, right? As someone
Right.
who buys things using credit and debit cards, how we were forced to make quick changes
Yes.
for the sake of what was going on in society. And so we had this huge jump. And for
Mhm.
me, it was fairly easy to adopt a lot of these things and,
Sure.
tap to pay, just all the things. But did you see any resistance in that from an end user perspective?
Absolutely. A lot of doctors and dentists were concerned that from a generational perspective, they would be alienating some of their patients because they just could not adopt to that technology. And we all been there, right? We all have seen that some generations are just so much more adaptable, and there are some generations
Yeah.
that aren't. So that was part one. And part two is always the rate of change in the healthcare office. Their tolerance level, if you will, is often tied to keeping the practice going, how fast patients are coming in and out, how quickly they can adopt to new technology, and how often they can change workflows. So there's kind of twofold. There is the type of patient demographic, their technology adaptability or ineptness, and how much the practice can withstand to roll out new technology. Remember, we add on the idea that there was a lot of turnover in staff and continues to be staff issues in the healthcare industry.
Mm.
So keeping things status quo and the rate of change are intimately tied. When you're having that much turnover and you have to keep things as stable as possible because you need to train new people and bring them on, it becomes cumbersome to always be looking forward into new technologies. One thing that we did see that was quite surprising was the amount of technology that was layered on, but not being utilized. At the patient level, they need that partition. They need that come try recurring payments, try to pay online, go to the website. Like they need a little bit of reassurance. So if the staff doesn't have time, that patient's still walking out the doors to me, they're going to get a bill in the mail that they're going to be able to pay the next time they come in. So there is a partition there. Sometimes we really try to help them break that down to know part of this does become dependent upon the staffing to tell a patient, well, we're switching over to an online scheduling appointment setting. So please know you can also go on our website and make your appointments online. You can also pay your bills online. So that communication can sometimes be hindered just because patients need to be led towards that and need to be shown how that's the new way.
That makes sense. It's an interesting dynamic because you can't force people to adopt it, and you do want
Right.
to retain them
Right.
as patients. And so I think that you've opened my eyes a little bit. It shows where it's forcing maybe those on the administrative side to do double the work now, or maybe some of it has been taken off of their plate and been automated, but they have to then watch for who's paying in this way, who's confirming their appointment online, and who do I need to continue to reach out to personally and send a paper bill to as well. That's really
Correct.
interesting.
Yeah. There are many nuances.
Yeah. And I'm sure, like you mentioned earlier, this is going to continue to change. As a people, we want to see things improve. So we'll
Yes.
never be done with the technology here. So as my generation gets older, as the next one gets older, we watch and see ourselves kind of get stuck in the same places, right? No, I just
Yeah.
want to do it on my phone, and there'll be some other new cool way to do things.
100%. If you just think about, and I'm sure the amount of people listening have a smartphone. If you think about just your transition over the last 2 to 3 years, at first you used text and email
Hmm.
and obviously phone calls. But now think about what you use at your fingertips, how many more apps you use, how much more connected you are to your phone to run your life. So what's
Hmm.
interesting is we've seen baby steps happen right after the pandemic, and now we're seeing more and more adoption. Now we're seeing it to be very much the norm where I sent an email to my provider. I have to go into a portal, of course, to do so. But these are things that are happening slowly and surely, and they're good signs. They're healthy signs. I think, unfortunately, we'd all like to see that happen a little bit faster for the benefit of the practice and the health of the practice. But it does take time.
Yeah, absolutely, it does. Let's look really quickly from the practice perspective. And what do you think providers should watch out for when they're implementing a new payment system?
Well, I'll tell you, there's quite a few things. One is when they're vetting, almost a series of a checklist that you can go through. And the obvious one is going to be financial. But I think there are other very important aspects of this as well. So obviously understanding the fee structure and the rates, 100% important. The amount of integration that you can get, because if you can remember that most important at the healthcare office is not just the payment data, but it's the patient data. So you're
Mm,
marrying up a financial track with something that we can't ever underestimate is the importance of privacy and patient data. So you're marrying those two pieces up, which makes this very different than any other fintech or other industry. And when
that's
you have
true.
those two things riding in, security is the most important, but marrying that up so that it is clear and concise so that I know that Christy came in for her annual visit. Her payment is $500, but her insurance pays X. She owes Y. It's gathering all that data that becomes cumbersome, and it's times X, right? How many patients are you seeing every single day over and over and over where you're bringing those data together, bringing that data together? So when a healthcare provider is looking for a payments processor, that is that's one of the most critical pieces is if you can integrate that data into your patient management system, you have now automated these two ends, and it just helps significantly on the bandwidth of your staff. So would always say that that should be a very critical component because there's plenty of integrated processors out there and it will just make your life that much easier. Nobody wants to do manual work and nobody wants to be touching payment data.
Right.
There's, obviously prone to errors, makes reconciliation difficult, things of that nature. The other things I would absolutely say is, and I say this to my own team when we're dealing with vendors as well, is find out, get a referral, talk to somebody, find out what they love, what they were surprised about, what didn't go well, because training is critical, especially on these systems at the practice, because they are using multiple systems to get things done, clinical based and then operationally based. So they've got
Mm,
two areas to always consider. So training should be key. Support should be key. Ease of use should be key. They should not have to go into multiple systems and log in because that is just more and more time to slow down. When you're checking out at the doctor or the dentist, you don't want to have your patients standing around for a long period of time. So I like those things for our healthcare practices to be always on the lookout. And I can't stress enough that having a partner that understands those core issues that healthcare providers face, there's not enough I can say about working with people who understand the industry and understand the stress levels.
Absolutely. There's so many nuances. Just knowing that from a payments perspective myself, and then you add on to it all of the ins and outs of the healthcare world.
Right.
And as you mentioned, just that stewardship that we have over people's personal information, it gets really
It
complex.
does. Very quickly, yes.
Yeah. So, in what ways have you seen payment flexibility or the lack of it impact patient trust and retention?
Sure. I think that we love to believe that more options are better. We definitely saw the idea that recurring payments, paying over time, patient financing should be ways to help patients get more care. That was the primary thought, the primary driver for us was how do we help patients really afford care, so to speak?
Right.
And I think, though, that it does go back to our conversation where a lot of it is on the staff to explain those options are available. Some patients will take it, some people won't. But how do we offer them enough so that they can afford it if it is a very big bill? These things are available and it does help the finance side on the patient, and then it gives the staff the ability to extend it out. So I think those are really critical. I also believe that card on file or putting your card in a vault, so to speak, so that you're not pulling out your card all the time. That is a level of convenience, but is the way we do this, it's the way we interact with the world. You don't have to take out your card for an Uber. You don't need to take out your card for Amazon. You don't ever really think about your Netflix because it just charges you. So where we can find those areas of convenience, mimic what's happening in other industries that are adjacent and help patients just live their lives the same way, I think we go a lot further for the practice to get paid more quickly, to get patients in and out and able to afford that care and get access to care. And then they are also doing it very fluidly. So we definitely see the impact on days outstanding for bills reduce when we have these types of mechanisms.
Interesting. You think a bit about the history of certain industries, healthcare being one of them, where you just think, well, if I don't have great insurance, I don't know what I'm going to do.
Yeah.
I guess I just can't pay it and I might need to declare bankruptcy. Like there just were these really big
Sure.
extremes. And we're finally into an era where there are these options. And it really makes life easier for both the patient and, like you said, the hospital staff or the clinic staff, anyone who is needing to work with these people, because who wants to put someone in medical debt? No one loves that on either side. And so being able to have this for them and make it so that payment is easy and it takes a load of stress off of both parties.
Correct.
It's really amazing to see just how that has changed over the
Yeah.
years.
Yeah.
And I love to hear that you're seeing a higher rate of payment
Of
within
course.
a shorter period of time too. That's
Yes.
really cool.
Yeah. So where we can help create these areas of expediency, I'll give you a great example. Like, so in a
Yeah.
text message, right? There are statistics out there that say we open up a text within 5 minutes of getting it, or even less probably at this point. So that the likelihood of us reading a text, responding to a text, and taking action is it is very high.
Yeah.
Email is probably a little bit less, but it having a link to an online payment, again, better practice. But
Mm-hmm.
ask yourself if you would ever respond to a bill that comes in the mail and put your credit card number down.
Right.
I'm not
Right.
going to do it, right? Like people now understand the risks of sharing that kind of information. So when we think about how to get paid, there are levers that absolutely create a velocity, which is great. So then we go one step further. Imagine if you can send text out in bulk. Imagine if you had called 1,000 patients who had outstanding balances, and if you could send that out in bulk, we have the technology to do it. it just starts to allow a lot more relief to a staff person. And again, you're using the technology to work harder so that we don't have to have people spending all of that time out there. So that those are a couple of ways that we've seen some significant growth in the and reduction in AR.
Yeah, that's amazing. I wanted to ask you a little bit about like integration and branding. Like, what does it take to embed payment technologies into a practice's workflow, and especially without disrupting care? 'Cause you
Right.
can't put that on hold.
Right. Yes. Well, gratefully, we have an excellent product team and development team who makes it really simple. A lot of times we are now working with, we have a technology partnership program where we are working with firsthand the practice management systems in order to make that the best experience possible. But there are ways to post into the practice management systems to make it easy so that I know that Christy came in on Monday, had her appointment, and she either paid in full and we're just waiting for that reimbursement to come back around, or we need to send her a bill and we need to collect. Those integrations are, there are thousands of them. They vary very much by even going down a little bit deeper into verticals. Dental experience is different from a chiropractic experience, is different from a primary care experience. So how we can help make sure that in any way, shape, or form, and it's almost impossible to make this as essentially consistent, but we do
Mm.
have these very distinct best practices where you are not sending out a paper statement. Maybe you're sending them a text. Maybe you're sending them an online a reminder, giving them those opportunities before you have to go and stuff an envelope and put a stamp on it and wait 30, 60, 90 days.
It really is such a big ability to speed things up. I'm dating myself, but I worked in admin back in those days of stuffing envelopes. It was
Sure,
not fun.
sure,
We
absolutely.
can we can
Even
all be thankful. Yeah,
yeah,
sorry, go ahead.
and you know, we see, so this is one of the key things for us is that we see this happening already in the government. We if you recently saw the Treasury Department made a statement that they are going to eliminate sending out checks in the near
Mm.
future. So these are the kinds of things that we look at and say, okay, we need to make sure that healthcare is ready. So when we think about creating our products, we're always looking ahead to the next big thing so that we can ensure that our healthcare providers are protected, that they have solutions, because we always are trying to ensure that if we make their lives a little bit better and we help the financial health of the practice, that they can deliver more patient care. That's the ultimate dream of it. That's the ultimate vision of it. But what happens, I think, sometimes is there's a lag, but there are signs. And if you're paying attention to the signs, then you can start to prepare yourself for it and start to then look at areas in the business that are causing the most friction. Where is your staff spending the most amount of manual time? And then that starts to give you the blueprint of where you can add in technology to help, where you can get services to help, and where there might be cash flow problems that you can solve.
Are there certain, maybe common signs or milestones that you see regularly that would indicate it's time for an upgrade or overhaul?
Yes, exactly. So days in AR is probably one of the biggest indicators. Patients not having any idea of where to pay and just not knowing that you have online options. So sometimes they don't know that there are financial ways to help them afford care. So sometimes just patient communication or miscommunication. And then I think the other big driver for us is if you have if you have access to these technologies, are you able to use them? Is there time in the day to sit and say, what if we worked this differently? Where are these efficiencies that can be found? Can we leverage our current vendors? A lot of times current vendors can be a big source of help and or at least then just even ideas that you can flow back and forth. I think those are some areas that we see as indicators of where we can help. So vendor consolidation, cash flow, and patient communication.
Which are things that I think would be pain points really for any practice that you want to find a solution for.
That's right. Yeah.
Yeah. So, what strategies have you seen work best in encouraging both staff and patients to adopt new technologies and payment tools?
So oftentimes the staff will adopt something and then think it's great and then really kind of get stuck on how to help patients adopt. Perfect example is that generational gap is how do we help people feel comfortable using the technology? So what we've seen is one, obviously always still word of mouth, explaining, taking the time, or iPads sometimes even help to get people used to using something that's a little bit bigger, a little bit more user friendly. You can digitize forms like in the office. So if you have a question, you can go up to the office manager or staff person and ask some more questions. So sometimes it's just a matter of wading into the pool. So that can be very helpful. And then signage, believe it or not, just putting it out there, making sure that the website is consistent, that the website shows, because we are a more digital native species now. We are doing things like looking for reviews, booking appointments online, looking at where people are located if it's convenient. That digital footprint definitely helps providers attract patients and then
Hmm.
retain them and get them set up a lot faster. A lot of times we'll see, someone have a great website, but they have a form where you've got to have access to a printer and then they're printing out forms and then maybe they forget. So anything we can do to help digitize the journey and put it in their path, even if you're emailing forms, make sure if they're fillable, people who have phones can fill them out, or if you want to give them an iPad at the office. So wading through it slowly, but making sure that there are some checkpoints down the road to digital. This digital journey will be very helpful for adoption.
That's a good point. I hadn't really thought of it, but it does make things simpler. As someone who generally is fine adopting technology, I hadn't thought about the fact that as I walk in and they hand me an iPad and say, "Hey, fill this out," that really is simplifying things. It's almost just like a, "Hey, here's the next step from
That's
paper,"
right.
and you writing
That's
in with
right.
pencil.
Yes.
Here you go.
Yes. 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 That dreaded clipboard and pencil. Like we don't want that for anyone anymore because, again, pandemic, germs was one thing, but also
Yes.
now it's someone has to manually key that in. So how can we help them speed that up? So that's not where they're spending their time or their day.
Exactly. It takes so many steps out of the picture when we can just put it right in
That's right.
and then makes future visits easier and just
That's
all of
right.
those things. So, how do you, or do you ever have to address this? You may not have to, but if you do, how do you frame the value of these tools in your practices, communications, and marketing?
Absolutely. This is one of our biggest uh, challenges and biggest perks. Whereas people can feel the difference pretty instantaneously. There isn't a long wait to ROI. There isn't a long wait to see the impact. When we are
Yeah,
able to connect these systems and connect the data, you can start to see how quickly things move. And then it's almost so natural and organic that they come in, they log in, they move on. And this becomes a much more well oiled machine. They can watch receivables and cash flow increase. So I think those are the big things. Of course, we always look at the end user, the patient as let's make it easier for them because as we make it easier for them, the staff definitely reaps the reward of it. So if I was to say, where is the biggest benefit for when people do actually take the digital journey? And because the digitation has to happen before automation of anything. So when they actually start to pivot there, what happens is an enormous amount of relief. I don't know how to put that into words or have that feeling in a piece of flat collateral, but what we hear all the time is it's just better. Simple. Like sometimes they can't put their finger on exactly what it is or where it is. I have customer reviews over and over that just says it's just easier. It's just better. And I think you can really just think about your phone is how much more connected you are in life because you're digital. You
hmm
don't have, I have software that tracks where my kids are at. Takes a huge, it's just better. I have less worry when I know I can just look at an app and say they're safe. It's the
right.
same thing for these types of technologies where there is a sense of relief because there's less manual effort, there's less looking, there's less waiting. It's a much more proactive approach to running your business.
It really is and simplifies so much.
It does.
One last thing that I wanted to touch on with you is talent and technology. Obviously, we have a lot of people coming out of college who are maybe more tech savvy and so forth, but have you seen a difference where those who are investing in fintech versus those who do not, and how that impacts their recruiting and their maybe retainability of employees?
Sure. I think there's definitely a correlation. We see a much higher adoption rate in a scenario where there is centralized, whether it's either a service organization or centralized billing or centralized operations. We see a tremendous amount of technology adoption there. The smaller practices, obviously, depending upon bandwidth and depending upon their tolerance level, are obviously slower to adopt, but they are adopting because they know in order to be competitive and in order to keep up, that is a huge selling point for both bringing in new patients and retaining. I think that this generation is absolutely expecting it. And I do think that that is a risk to a lot of our smaller practices. I can see it in my children. They're on their phones and they're using urgent care almost like a primary care physician. Very different
Interesting.
than way back when of going to the same doctor for 20 years and developing that relationship. So I do think that it is absolutely tied to the times and the obviously the tolerance and the expectations. But where I would say I've been very encouraged is that there's a much more openness to doing so, but it's really in how you can help people train and use it a little bit at a time. I do think that it is not a switch that you change over in one night. I do think that there is a learning curve, that there is a curve and a ramp. And I think if you can think about it that way and maybe have one super technology person on the team who's willing to be the test case for it, try it out, put it together, put the documentation together, help people through it, that these practices will see absolute better results for it.
And it allows you to be strategic and even customize things based on what type of office you are, what type of clientele you have coming in, and just really think about what's going to be the next right step for them.
That's right. That's right.
Yeah, interesting. Is there anything that we haven't talked about that you wanted to make sure we do hit on today?
Oh, there's always so many things to talk about. I think for me, I think if I was to wrap up, I would just say that automation just continues to make things better. And I think that there is an element of automation and AI that go together. And a lot of times right now, we're hearing a lot of words about AI and how that will help. And it has almost become people are not sure what to think of that. So I would always consider that there is a logical sequence. There's making things digital first, then automating them, and then AI will come along on the back end to try to make things even more intelligent and even more intuitive. So if you can, as either a practice or a business, just think about those key things are where are the friction points and how can you digitize it? If I'm spending 2 hours a day keying things in, can I make that digital? Then can I take that digital form and automate it into my software? And then if once it's in the software, can I then make logical decision based outcomes out of that? Can I say, well, if Michelle always comes in the morning for cleaning, and I have an opening, can I send her a text that says, hey, we know you love 8 o'clock on Mondays. We have an opening. So the logical steps to how to make this better and how to create this more efficient workflow, it's there. But I think people sometimes don't know which piece comes first.
Yeah.
And I think that AI is a great tool. There are steps before that have to happen. So I just hope that laying that out in a sequence and thinking about it that way helps some folks out there who might be trying to figure out how to use technology to their advantage.
I like that. I think that's a really great and easy way of explaining it that I haven't thought about before, but it's just like, yeah, get the practices in place and then let AI come in and kind of tie up those loose
That's
ends
right.
and bring everything together.
That's
That's
right.
wonderful.
Awesome.
Michelle, thank you so much. I'm so
You're
glad that you were
welcome.
able to take some time and join us today. We really appreciate it.
Absolutely. Thank you for having me.
Thanks for watching our podcast today. I'm Kristen Nielsen. I'm the owner of Copper Canvas Ads Agency, and we partner with fintechs to help them scale their business within a 12-month period. I've been in the industry for over 20 years, and I've seen how saturated the market can be, and therefore how difficult it can be to make your business stand out in a sea of other fintechs that may look similar or maybe even slightly different. But how do you make yours stand out? How do you get your message to the right people and those with high buying intent? That's what Copper Canvas Ads Agency is here to do. We are a growth partner, and we take a deep dive into your business to really understand what your strong points are, where there may be areas of weakness, and how we can fill those areas of weakness and create a plan to move forward in a strong way and really scale. So if you are interested, simply go to our website, coppercanvasadsagency.com, and schedule a time. There are buttons right there on the front page for you to book a time, and then we'll love to talk to you and see what we're able to do together.